My namaskar to all of you, respected Sri C. Kumarji, Dr. C. Kumarji, the National Organizing Secretary of Vigyan Bharati, uh, Acharya Balkrishna ji, all the dignitaries came from across the globe, dear students, my colleagues, faculties who arrived in this holy city of Dehradun for the Mahakumbh of Ayurveda, the World Ayurveda Conference. Thank you for coming and my pranams to all of you. This morning in the first session, I am very happy that though it is late, but there is a very good gathering. Even in first session, I am aware that there is a lot of delays of the flights and arriving, and then you know um, almost 50% of us do not have an idea about the cold in Dehradun. So all those problems, but still we have very good gathering. So thanks for that. Uh, when we look at digital health, we are here to talk about digital health and then Ayurveda perspective in its roadmap. So there is a great background in India. We have a great digital ecosystem in country Bharat. We have a 2030 agenda for sustainable development. So we are trying to match this and to achieve the universal goal. And then for that digital health, it 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 is envisaged that it must prioritize ethical, safe, secure, and equitable practices, and guided by principles of transparency, accessibility, scalability, interoperability, and privacy. And India is leader. We know that there are a lot of areas of digital ecosystem in India, and now the digitization has an impact on all of aspects of our lives. It could be environmental aspect, social community networks, or even political messaging, or commercial marketing, or infosphere, or working conditions. And there are different areas like education, housing, health systems, including traditional medicine, literacy. So all of this, when we look at the digitization in health, the primary goal is equity in health and well-being with scalability. So let's look at the initiatives in India. We have this Digital India initiative. We all know about that. Is a flagship scheme aimed at fostering development and transparency through digital transformation. And there is a National Digital Health Blueprint published by Government of India. It says, it envisages the national digital health ecosystem to ensure accessibility and equitable services nationwide. It also supports for the universal health coverage, and we have to make it happen. We have Ayushman Bharat Digital Health Mission, and this ABDM has significantly stride that we have ABHA ID, this Ayushman Bharat Health Account number for all of the citizens of India. And did you know that 50% of Indian population is now covered with ABHA ID, and it is going on at a very fast pace. In Uttar Pradesh, 2/3 of the population is covered by ABHA ID. And there are a lot of, this, when we look at the ABDM ecosystem, it covers all. It is a 360-degree ecosystem where central government, state government, the hospitals, public health facilities, insurance companies, TPAs, health tech companies like Bala Pesalas, or doctors, practitioners, traditional medicine practitioners, NGOs, all of their regulators, all of their are having this incorporated digital health ecosystem in India. And this is something we call it Vasudhaiva Kutumbakam approach, citizen-centric paradigm shift in healthcare delivery. It has all which I mentioned. You can see in chart that everything is included, including self-care modalities, including informal care and community care by public health delivery system and private sector. So everything is included where citizen is in center, and it has a health promotion, diagnosis, therapy, rehabilitation, and long-term care. Now, when we look at the digitization in traditional medicine, National Health Policy in India 2017, it envisages the integral role of technology, e-health, m-health, cloud, IoT, wearables, etc. in healthcare delivery by advocating the visualizing digital health technology ecosystem, and digital tools will be used for generation and sharing of information about Ayush services and Ayush practitioners for traditional community level healthcare providers and for household level preventive, promotive and curative practices. So this is a mandate by the policy document of the Government of India. And then Ayush Ministry has visualized the Ayush Grid. Ayush Grid is a tech solution for everything about Ayush. It may include education, public health, regulation, research and so on. All of the aspects you can see that all of the aspect is covered in Ayush Grid, and it's also empowerment, education, empowerment, consent, federated architecture, data governance, everything is visualized under this Ayush Grid principle. And this architecture is very interesting. This is being done now with BISAG N. You know that institute is a Government of India institute under Ministry of Information Technology, Government of India at Gandhinagar, Gujarat. And this very institute has developed PM Gati Shakti program also. And now this institute is developing Ayush Grid architecture. Lot of things has already happened. There are different 3 layers. One is the citizen access layer. Citizen access is Ayush mobile applications, My Ayush portal, Ayush call centers, and it's the top. There is a state layer, there is a national layer, and there is a core layer. So core layer, you can see that core registries, morbidity codes, core directories, drug codes, architecture repository, other master codes, etc. are there. And actually this architecture, we have almost completed 50% of the development of this Ayush Grid architecture, and it has a potential of, having transformation in the area of Ayush with the scalability of the digital service in the Ayurveda and other traditional medicines in India. This ecosystem, there are some use cases what has been done already. For example, this Namaste portal is developed by Government of India, and this integrates. You can see there are 2 color codes. The red code is proposed, it is being done, and blue is already done. So we have WHO ICD-11 traditional medicine module. It is published by WHO with the support of Government of India. We have standard terminology of Ayurveda, Siddha, Unani, published by WHO. We have Bureau of Indian Standards, which these standards will be escalated to ISO in near future, and this is also being done, already done. We have Clinical Trial Registry of India, where all the clinical researches are documented there, and then also ontology framework for Ayush medical systems. So this Ayush Namaste portal is hosting all of this, and has a potential of having a master application for all of the things about Ayush. And then we have also Ayush Hospital Management Information System, which is an EHR solution which is implemented across the Government of India hospitals and facilities as a pilot. And for pilot, we did 50 million patients pilot, so it is now standardized. The AHMIS, I was just mentioning about AHMIS, and you can see that it has potential of providing electronic health record at the primary level, secondary level, having referral gatekeeping facility, tertiary care, convergence with health insurance, PMJY, healthcare facilities, CHCs. So this red code is still being done, but rest of the things is done, and it has all the scalability, and this solution is also in sandbox. So let me explain about sandbox, that the API sharing is possible. So if some entrepreneurs, some startups want to develop some EHR, the HMIS is having, they can talk to each other, they having interoperability, and that is the unique thing, and it is also ABDM compliant. So all of the soft solutions of Ayushman Bharat Digital Mission, they have interoperability with this AHMIS. Another example is PM Gati Shakti Master Plan. So you know that this is a global information, this is a model connectivity platform where all the infrastructure is mapped into this PM Gati Shakti master plan. So what Ayush did, that we have global information system for Ayush. We have at least 7 layers there, and under these 7 layers we have mapped all the government facilities of central government and state governments under PM Gati Shakti. And also there is a realization of P5, that is a personalized, preventive, predictive, participatory and promotive healthcare. So, and this is through HMIS or teleconsultation services and Prakriti analysis like Bala Pesalaji mentioned. And then AIM Yoga application we have developed for WHO. And this WHO application is actually developed by India, Morarji Desai National Institute of Yoga, and it is available to all member states of WHO. It is a contribution of India to the rest of the world. Then we have this Gati Shakti I was mentioning, and I will not detail it, but then there is an asset mapping, and we have a pilot study already done in the states of Mizoram, Karnataka, Andaman, Nicobar, Telangana, Lakshadweep and Puducherry. The P5 medicine, how to realize? If there is less noise, if it is possible, थोड़ा सा आप आवाज कम करेंगे, थोड़ा आप करते रहिए लेकिन आवाज न करिए. So this P5 medicine, we have HMIS, we have Ayurgenomics analytical tool, teleconsultation services. It's all onboarded. We have teleconsultation services at eSanjeevani platform also and AHMIS platform also. There are self-care model also. This Vibreak application, I will urge you to look at your mobile, and then you can see on Google platform or iOS platform, there is an application of Vibreak. This Vibreak application is the new age workforce, white collar jobs where we sit all day and keep our eyes on computer, and this endless. So this Vibreak application is available for 6 minutes of short yoga meditation pranayam, and it is very popular. Just to mention that Government of India has a iGot platform. 1 million government employees have signed up for this. It's most popular course available for the government employees, which is Vibreak. And our Morarji Desai Institute is felicitated for this achievement. The another is AIM Yoga app I just mentioned about, that we did for the WHO. In education sector, we have online platform for counseling which is error free. It brought lot of accountability and transparency. We have e-books, Ayusoft software we have taken over from CDEC, and now we have developed it further. Is a diagnosis support system for the physicians also. And then we have Ayush Next portal. We also work with BISA again for education life cycle learning platform, and it is being used by our National Commission of Indian Medicine and National Commission of Homeopathy. In the area of research, you will be surprised that in most of the such functions, the outside speakers would mention that Ayush is good, is a 5,000 old practices, Ayurveda is very old and is very good, but you need to create evidence. So they don't know that there are a lot of evidence. So what we did, we have created an online index which is available to all. If you type on your search engine, Ayush Research Portal, you can find this. And this research portal is having 43,000 plus peer-reviewed journals indexing, 43,000 plus peer-review or index journal publications. And you can search it, you can download the full paper, you can download the abstract, you can validate, and you can see a lot of things. So there are a lot of evidences. We made it a digital initiative to scale up and to have a better information to the public. Then also drug discovery, architecture, evidence-based medicine, in this area, a lot of things has happened. So I would like to cite an example of COVID-19, that we have Ayush 64 and Kabasura Kudini, which was repurposed for COVID management in India. And this was done in less than 6 months. All of this validation, it was the repurposed drugs. All of the validation, rise from docking studies to preclinical studies to large-scale observation studies to large-scale multi-center trials. Everything was done in 6 months. through the digital initiatives, that is I wanted to convey, through all this translation, bench to bedside, clinical implications, and everything was done for Ayush 64 and Kabasra Kudinir, and it has contributed to the country during COVID crisis. I would like to cite a publication which was published in Frontier in Public Health about Ayush 64. During COVID crisis, in the second wave, we know that hospitalization rate was 6%, and then the mortality rate was 3%. At that time, we, with the help of Seva Bharati, we distributed Ayush 64 to 1 lakh patients in less than 15 days. And then we followed them. Out of these 1 lakh patients, 65,000 patients documentation was done. 3 weeks follow-up was done. And then we have analyzed and we found that out of these 65,000 patients, nobody died. And out of these 65,000 patients, only less than 300 got hospitalized, which is less than 0.5%, when there was incidence of 6%. And there was 3% mortality, and in these 65,000 patients, everybody improved. Nobody died. So, and it is published also. So this is kind of, how we can scale up through digital initiatives. It's a very good example. Then we have governance and capacity building area. It's like transparency by Ayush NGO portal, in which all the schemes of Government of India is done paperless and faceless. Then there is also another thing is about Ayush Information Hub. It is already mentioned. There is an archival system, NGO portal, e-office implementation. When in 2017 I have taken over as a secretary, the e-office implementation less than 4%. Now it is 98%. So that kind of scalability is also there. Then as TKDL is also another example. With the help of CSR, we developed this traditional medicine digital library. We are aware that more than 10 lakh such documentation of traditional recipes and traditional practices was recorded there. And then it was able to prevent the patenting of public knowledge of Indian traditional system. I have only 2 minutes more. The drug licensing and standardization. We have developed this e-Aushadhi portal, Namaste portal, e-Charak application. E-Charak is a buyer-seller platform when medicinal plant growers can sell their plants to the industry. And this portal has grown by 500% in last 3 years. That is the kind of scalability. Then online sale of pharmacopoeias is also another digital initiative. Then media outreach, we have in media Ayush campaign portal, we have showcasing of Ayush heritage by Sahi portal, showcasing of historical imprints, and also Amar portal is a manuscripts of advanced repository of Ayush manuscripts. Lastly, I am happy to share that we have participated into WHO and International Telecom Union initiative of AI in health, and we were able to, India was able to successfully able to get a separate vertical of AI in traditional medicine. And we are leading this AI in traditional medicine, and it is also having, there are a lot of initiatives like Center of Excellence in IIT Jodhpur, or blockchain platforms is an area, sensor development, open source network, Bala Pesalaji is helping in these areas. And it is one step, it's a big step for creating evidence-based Ayurveda with precision, and that is one of the very interesting outcome. I would like to also mention about Desh Ka Prakriti Parikshan Abhiyan. Our Honorable Minister Sri Pratarap Rao Jadhav ji has envisaged this program, and there is a lot of potential. It is already going on. More than 26 lakh Prakriti Parikshan has happened already, and it will end on 26th of this month, and by that 1 crore Prakriti Pariksha will happen. It is all digitally done. So there is an application, there is a QR code, and it is very highly standardized. So what we are visualizing through this database of Prakriti of Indian population, we are envisaging that we will collaborate with Institute of Genomics and Integrative Biology to have some total DNA analysis of some of the sample size, so that we can correlate very effectively that there is a genetic predisposition or there is a connection of human genome with Prakriti. So there are a lot of such things are happening. Lastly, what I said, there is a conclusion that we have tech-enabled solutions now through Ayush Grid, It revolutionizes the healthcare with innovations that enhance effectiveness, safety, and affordability. We have also balanced approach which leverages technology for adoption, accessibility, acceptance, scalability, and innovation while preserving the fundamentals of traditional medicine, including Ayurveda. And empowering practitioners, advancing training, quality analysis, and integrating technology and IT as core components in Ayurveda education. My namaskar to all of you. Thank you.